The Contemporary Motor Learning Theory, presented by Tori Rhodes, Lisa Goolsbee, and Teresa LaFranca. A motor learning theory is a set of processes associated with practice or experience leading to a permanent change in the capacity for producing a skilled action. Traditional motor learning theories were more passive in nature, meaning that the therapist performed actions to the client. They were based on hierarchical models, focused on addressing abnormalities, more bottom-up in nature, and focused more on the issue than on the person or the occupations that were being impacted. For the most part, the contemporary learning theories are top-down in nature. They're occupation-based, client-centered, and they have a foundation in the dynamic systems theory. This means that they emphasize that the natural world doesn't always follow a specific pattern, and they have to take into account the occupation factors, person factors, and contextual factors of each situation.
Contemporary motor learning is based on the rejection of the validity of hierarchical models and proposes there is an open loop system of control in which multiple characteristics of the task and environment are received by the central nervous system at multiple levels and contributes to functional motor recovery. It is a holistic systems approach aimed to improve all forms of movement abnormalities and disorders by matching task requirements and environmental demands and client abilities, making sure the client understands what is to be achieved and is provided with clear information about motor skill performance and outcome, and that the client is encouraged to independently problem solve and is provided with a task that is challenging.
Looking back into the history of motor learning theories, traditional concepts came to play in the 1930s and 40s, when neuromuscular maturation and these stages of motor development were widely accepted. There wasn't much research done between the 50s and 80s regarding motor development until the 1980s when the dynamic systems approach was introduced by Bernstein. Traditional theories viewed higher centers of the brain as having control over lower subordinate centers. Interventions often focused on weight-bearing and repetitive exercises that had minimal connection to meaning for the individual client. In other words, they weren't very occupation-based. At the heart of the contemporary motor learning theories lies the dynamic systems theory. This states that development is a nonlinear process, and movement is produced from multiple subsystems within the person, task, and environment. Changes occur over time as a result of the maturation of the central nervous system, biological restraints, and/or environmental factors. Most of these newer theories are task-oriented in nature, which kind of means they're occupation-based and client-centered. So they'll focus on real objects and real situations and occupations or interests of a person's life rather than just tedious tasks. These approaches state that random practice is best and functional tasks help to organize behavior. Occupational performance is the outcome of person and environment factors, and they also believe that experimenting with various strategies to find solutions to motor problems is best. Fitz and Posner's stage theory is another one that we'll touch on. Stage 1 is the cognitive stage, in which an individual relies on memory and consciously attending to movements. Stage 2 is the associative stage. Here, procedural memory starts to come into play, and movement becomes a little bit more fluid. Stage 3 is the autonomous stage. Minimum effort is required, and confidence starts to increase. This theory is nice because it breaks down the process that a person goes through as they learn or relearn motor concepts. Here are a couple more concepts or ideas that apply to these modern theories. The acquisition, retention, and generalization of learning kind of go right along with Fitz and Posner's concepts we touched on earlier. The contemporary motor learning theories believe that random practice, or repetitive tasks in a varied sequence, is better than blocked practice. And whole task practice is better than breaking it down and practicing in parts. Internal feedback is more meaningful and powerful than external feedback, and faded feedback is generally better than increasing amounts of feedback. The motor learning theory emphasizes the importance of activity analysis, the grading of activities, and the use of natural environments. Next, we're going to go over a couple cool theories and interventions that go along with them in which you can apply to your occupational therapy practice. Constraint-induced movement therapy promotes functional use of a hemiparetic upper extremity. It also speeds up cortical map reorganization and addresses learned non-use. Robot-assisted therapy is another piece of modern motor learning theory practice. This form of therapy can reduce the workload of therapists while still fulfilling intense, repetitive, task-specific techniques required for motor learning. There are two main types of robots that are used for robot-assisted therapy. End effector robots are connected to one distal point and their joints do not align with human joints. Force is applied at the end and it changes the positions of other joints simultaneously. The other common form of robot used in robot-assisted therapy are exoskeleton robots. These resemble human limbs and are connected at multiple points. They also match human axes. What you see here is a mirror image motion enabler. This is a form of end effector robotic therapy, in which a client holds a handle attached to an arm support in order to perform goal-directed tasks. Virtual reality rehabilitation allows experiences and interactions in 3D virtual environments. This form of rehab is promising for motor recovery after traumatic brain injuries, strokes, and other neuromuscular injuries. The game-like training experience of virtual reality can be more engaging for clients while they're still in a safe and controlled environment.
Therapy environment. This type of virtual reality software allows the client to see both of their hands as active hands again. The avatar and the therapist guide the client through challenges, and all of these challenges are created by the therapist, so the client can train their hand for functional use. Each task challenges the client to activate a specific muscle in a sensitive way.
Since the contemporary motor learning theories are based around the completion of functional tasks and client-centered care, they align very well with the foundation of occupational therapy. Ecological models, such as EHP and PEO, work really well with these motor learning theories. These models, as well as contemporary motor learning theories, emphasize the relationships between the person, environment, and occupation.
Evaluation procedures should focus primarily on integrating the extremities into the performance of functional tasks. For example, TEMPA and the Arm Motor Ability Test objectively measure the client's capabilities when using the affected extremity during performance of tasks. It is also recommended to obtain a self-report from the client, such as the Canadian Occupational Performance Measure, the Motor Activity Log, or the 36-item ability measure, where the client is asked to report the ease or difficulty of performing everyday tasks. While considering a task-oriented approach to motor learning, it is important to remember to first categorize tasks according to the level of function a specific client is experiencing. For example, a client who has no functional use of their arm can be taught ways to protect their shoulder, self-range of motion, or positioning. Whereas a client who is experiencing limited range of motion of their arm will make use of activities such as applying body lotion, brushing their teeth, washing body parts, buttoning a shirt, ironing, polishing, sanding, and vacuuming.
In conclusion, we've added some evidence-based research, some articles that you can check out if you'd like to learn more about these contemporary motor learning theories. Feel free to pause these slides to dig deeper into this information.